Okay, it looks like we are live.
Okay.
All right, it looks like we're live.
Yeah.
All right, welcome
Hi.
back. Welcome back
Yes.
to
How
the
you
show,
been?
friends. Yes, I'm Dr. B.
And I'm Dr. Z. B and Z.
All right.
We're here for you again for your questions. Thanks for sending them in.
All right. So, is it seasonal gloom or clinical depression?
Yeah. We looked through a couple of questions we got, and one of them came up that we talking together, we're actually realizing that a lot of people have asked us some version of this, and so we're going to do our best to tackle it. It's we'll dive in, but honestly, it's to do with like this time of year, but also especially in places where winter is really, really hard to get through.
Right, looking at you, Midwest.
And East Coast. Didn't you guys get a bunch of snow in Jersey?
Did.
Yeah.
We did yesterday as well.
I know. I had family tell me. Yeah. So, okay, so here we go. Our listener writes, "Dear Doctors B and Z, love your show." Love you too. Right back at you. Okay, I've been married 25 years, and for the back half of the marriage, my spouse gets really gloomy this time of year, right around daylight saving time. Okay. Midwest winters are brutal. How do I know if this is normal winter blahs or clinical depression? And when should we seek help for him? Okay.
Okay, this is such a good question because seasonal mood dips are normal, but sometimes the seasonal crosses the line into an actual depressive episode. We started talking about seasonal mood last week, and we said we were going to come back and talk a little bit more about distinguishing between seasonal affective disorder and depressive episodes. So this is a good segue.
Mm-hmm.
And so when the seasonal crosses the line into actual depressive episode, it's important to be able to tell them apart.
For sure. So, and clinical depression has specific criteria. Okay, we take criteria just a word for symptoms or things that need to be present. So the thing that we use as doctors, as clinical psychiatrists, is this diagnostic statistical manual. It's sort of like our book that we go through, to see, does someone have this clinical diagnosis? And a diagnosis is just a constellation of symptoms. And I want to also say that diagnosis is not a label. Okay, that's just really important to get out of the way, because a lot of people will say, I have this, and then that becomes your whole persona, your whole personality. It's not, it's just a way for other professionals in mental health and in healthcare to know what the other person's referring to, so that we're all on the same page as clinicians. So because you have to know what the problem is, and it starts with a diagnosis, in order to know what treatment you're prescribing or what interventions you're recommending. And it really starts with a clear idea of what the problem is. So even if you do have depression or anxiety or other things that's not going to define you as a person. It just makes it so we can better understand the situation, so we can then help and treat it. Okay. So let's walk through them. Will stay with us, because this is the part where people end up fast forwarding and then emailing us later with the same question. But to qualify for a major depressive disorder, you have to have at least 5 symptoms for 2 weeks or more. Okay. And they have to cause a lot of distress or impairment. So they interfere with your normal functioning. And they can't be described by, using substances, overusing, different recreational drugs or alcohol, or a medical condition. For example, hypothyroid often looks like depression, vitamin D deficiency, vitamin B12 deficiency. And that's why you come see us doctors, because we've gone to medical school, we can understand these things, or even we often recommend that you get lab work done so we can make sure we're not ruling a medical cause underlying. So, all right. Bola,
All
do
right.
you want to say what the symptoms are?
Yeah. So, what the symptoms are, what do they include? It can be depressed mood, sadness, feeling empty or hopeless, loss of interest or pleasure in things. We call this anhedonia. But again, it's inability to really enjoy things or experience pleasure in things that normally would give pleasure. We have appetite or weight changes, and this could be an increase in appetite and weight or a decrease in appetite and weight in some people. We also have insomnia, so sleeping too little or unable to sleep versus sleeping way too much. Another would be restlessness or slowed down behavior. All this agitation or psychomotor retardation. Low energy, feeling fatigued and tired and blah.
Mhm.
Feelings of worthlessness or guilt,
Mhm.
thinking someone's punishing you, thinking that how you're feeling is a result of something you did, and now like there's some divine punishment or karma happening to you. Sometimes also people have trouble thinking or concentrating. And at its peak or worst, people start to have thoughts about death or not living anymore, which is when things get super even more concerning.
For sure, for sure. So, and it's really, and in psychiatry, we know that many things are on the extreme end of that, and many things can be on the, the more mild end of that, and we act accordingly. And there's ways that we can kind of recommend things depending on how dire things are, or if they are mild. There's always recommendations we can make, but you know, you do need to have, according to this criteria, you do need to have 5 or more. So it's not just like one thing, like, oh, I'm a little grumpy or I'm a little irritable. And that's disruptive, and can be like, from a lifestyle and, quality of life perspective, problematic. But it's not just one thing. It's 5 consistently over 2 weeks. So you get the idea.
Right, right.
Okay. So now, I think, I mean, according to this and the listener's question, it does sound like, what he's describing falls under the seasonal affective disorder, which is a specifier for depression.
Exactly. Because seasonal affective disorder is not a separate diagnosis, so much as depression that reliably shows up when the clocks change and the sun disappears like it's ghosting you. So it's a form of depression that's just showing up again when the clocks change and the sun disappears.
Right, right. And with seasonal affective disorder, the symptoms map onto depression. So they follow a predictable pattern, usually the fall, or like this listener was saying, like the time change and the winter onset. And then the symptoms will alleviate once spring, the next time change, I guess, happens too.
That's right.
In the spring.
And the classic seasonal affective disorder tends to come with, oversleeping, increased appetite, especially with carbs, low energy, social withdrawal, um, almost given like the hibernating beer, but
Yeah,
sad.
yeah, yes, yeah, exactly. Yeah,
And if the symptoms meet that threshold, 5 symptoms for 2 weeks with
yeah.
functional impairment, it's time to get professional help.
Exactly, exactly. I mean, and here's the thing, like even if it's not a full, like let's say you have 3 out of 5 or 4 out of 5, or you're a little bit, on the threshold, but it's predictable, there's really no harm in getting ahead of the problem and being a little proactive. You don't, and ideally, like in anything in medicine, it's when you wait till things are the worst they could possibly ever be, you have many more things you have to do to get things back on track. So it's ideally you're doing things preventative or preemptive, or at the first couple signs of warning signs, or okay, I'm seeing this, now I'm seeing this, okay, we're seeing this again now, here we are in winter, and here this problem is again. So you absolutely don't need to wait for a crisis, and we would encourage you not to. especially if you've seen this now. This listener saying they've seen this in the back half of their marriage, so it's year after year after year. So
It's time
yeah,
to
so
do something.
maybe we can get into the treatment and the evidence-based treatments for it.
That's right. What are the evidence-based treatments? You want to take a stab at that, Z?
Sure. Yeah. So light. Okay. So light. So a lot of this is to do with the circadian rhythm. And we are very much in tune with the circadian rhythm. We have, glands in our brain, pineal gland, that are on an internal clock. And some of us are much more sensitive to changes in that. Time change, etc. Even a change of an hour or, just less light over the winter months can trigger that. And so light therapy is one of the most effective first-line treatments for seasonal affective disorder. So light treatment or blue light therapy or light box therapy, it goes by different names, but.
And I'm also going to say also you want a 10,000 lux light box. That's very important. That's what's been tested and trialed in trials and found to be helpful and effective. So it has to be a 10,000 lux light box. You want to use it first thing in the morning for about 20 to 30 minutes. And again, this helps regulate circadian rhythms and boosts serotonin activity, basically sort of mimicking the sunlight your brain misses.
Yeah. Exactly. And lux is the unit, is the strength of the light unit. Just if there's different, our incandescent bulbs have a different strength than other things, but we're trying to kind of like mimic the strength and the intensity of the light, of natural light. And we do have a list that we'll link up to the show notes, which is, a third-party, non-biased Wirecutter, New York Times Wirecutter list of recommended devices, different price range. But as long as the specifications, doesn't matter how expensive or cheap the box is, as long as it has that unit of light, then it should be sufficient for this purpose.
Okay.
And you want to also, I want to say, you want to put it no further than an arm length away. And you want to also make sure you're aiming it toward your eye, because the light comes in and gets absorbed by your eyes and goes to the back of your eyes, the retina, which is part of your nervous system, is part of the brain. And so you want to make sure you're aiming it. You're not putting this thing over there across the room. You want to put it, and you could be doing other things. You could be on your phone. You could be on your computer. You could be getting ready, at the mirror in the morning. As long as it's like aimed toward your light, should have that effect.
All right. Let's move on to medications. Again, temporary medications for some people, a seasonal prescription of an SSRI can make winter infinitely more manageable than it's been.
Yes, absolutely.
And this doesn't have to be year-round.
It doesn't have to be year-round. Exactly.
Right. Some people only would take the medication from around October to March, like a mental health snow tire for the season, just to help them get through, that season. And typically it's in spring, people start to feel immediately better once like the longer days come back again and people can wean off. Specifically for the seasonal type of depression, people then can start to wean off again around spring once they start to feel better.
And I think a plan like this, because I love a plan, and it's good to have a plan, but even for people that struggle with recurrent depression year round, but it might worsen and feel more heavy during the winter months, it's good to have, and often this is part of our plan, is to actually bump up the dose in the winter and bump it back down. So that's also possible, but you do know. And it's also a good idea to make sure you're scheduling an appointment. If you have a regular doctor, if you do, I'd recommend that you're scheduling them. Just make sure you have an appointment in September and October leading up to, because you know that this is coming around, so you want to get ahead of it. So.
To prep, exactly, prepping and getting ready so that if you expect it to happen, you might as well prepare for it and address it.
Exactly. Yeah. And the same thing with a therapist, right, Bola?
Yeah, that's right. Again, if it's a predictable pattern, with therapies, again, part of the plan in September is to, put on that maintenance therapy plan, see a therapist, see a therapist maybe every 3 months during spring and summer just to keep the relationship. But again, as you head into the seasonal period, you do a maintenance plan that's bumped up
and
for
then
the
exactly.
season.
And then once you hit it, the fall period, you're then now going into every other week or ideally every week meeting with your therapist, because therapy, especially CBT therapy or really any therapy where you have a very strong rapport with your therapist, is evidence-based. It's an active treatment, so we talk about active treatment, not just the light box and maybe the medication, but therapy is an active form of treatment. And so bumping that up during that time to give some additional support.
That's right. So I think those are the three core things, right? We've talked about light, we've talked about SSRIs, medications, which is selective serotonin reuptake inhibitors. We've talked about therapy. And now when we want to talk about other things you can do outside of those three core things to support, like supporting acts, I guess we should think about them as healthy habits.
Yes.
And this would include, again, all the things we all already know to do, like good sleep, having a good sleep schedule and structure. Again, if you've fallen off your sleep cycle, in summer and you're sleeping haphazardly during the breaks and things, it's time to, again, get back into good sleep habits, routine and structure, making sure that you're getting in enough hours, but also planning to go to bed early enough to get enough amounts of sleep. Exercise is another one. Again, body movement is documented to have so many benefits, not only mentally, but also cardiovascular benefits. So again, exercise, movement is a good supporting act. Social connections, meeting up with people, planning to meet up with people instead of hibernating as you're feeling. Minimizing alcohol and substances also can be very helpful. I tell a lot of my patients this, that alcohol is a depressant, and people are often surprised when I say that. And if you're someone who is prone to depression or gets depression, maybe alcohol, too much alcohol or frequent alcohol, even socially, may not be the very best thing for you, because alcohol can really act as a depressant. So minimizing that could really be a good supporting act to your treatment as well.
Absolutely. And alcohol also, not only that, but also, to go back to the sleep part, it really disrupts the back half of your sleep, particularly the proportion of REM sleep and deep sleep you're getting. Sleep is maybe the most important, I would say. And I would encourage people to read Dr. Matthew Walker's research, and he's done countless podcasts and talks and things like that, like sleep. Regular, consistent sleep, dimming down the lights to encourage your own natural melatonin production. Because dark signals I'm sleepy, I'm tired. Digital detox, if you can. I know that's a tall order, but if we can put these away for an hour or two before bed, that also just helps. And in general, I think winter blues, and these are not positive things, I think in general for mental health, but all of those things are really important. It's not influencer advice. Like, this is physiology. This is all backed by science and research, and it's not flashy, it's not sexy, but it works. It goes back to, these are the things. So we go back to basics when it comes to these things when you are feeling down. So then we got to do these things that we know are going to help you. And that might be harder. It might be harder when it's cold to make sure you get out and exercise and do all these things, but they really do help.
That's right.
Yeah.
And in addition to that, also, I like to think of things you can do ahead of time, especially if you're someone who has an established pattern, that you get, seasonal affective disorder, around this time every year. I like preventive methods, right? In addition to maintenance things, I like to think of things you can do ahead of time to prep yourself and minimize the chances or intensity or severity of this experience during this time. Setting boundaries, if family and engagement and interactions, because this time all usually coincides again with the holiday seasons. There's lots of gatherings, lots of expectations, lots of things that people are expected to do that adds to the stress. So if you're already prone to having a seasonal depression, thinking ahead of time what you can handle, how much you can do, and setting those expectations with family and boundaries can be a good way to reduce intensity or probability of falling into one.
Yeah.
Adjusting one's schedule could be a big one.
Yeah.
I always say this could be a time to look at your entire demands, your day-to-day demands, and seeing how much you can handle or how much you want to commit to handling, even work schedule, personal schedules. This may be a time to plan a little bit of time off, especially if you might be able to pair that with traveling to a sunny place to get a little bit of sunlight. This could be some of the ways to at least reduce the intensity or effect of what you're experiencing. And also looking at your routine weekly, and editing and auditing and looking at your routine and ensuring that each week is something you look forward to instead of dreading. Again, these are just soft things that are within our control that we can manage to help us get through this period.
Absolutely. I mean, it's, we talk about reinforcement schedules and sticker charts for kids and things like that. I mean, but as adults too, we need to kind of like dangle our own carrot, and we need anticipation. It improves our mood. Also, doing things that, we just look forward to. It just helps. It helps you kind of get through, the next thing, and having that is really, really helpful.
That's right. And so to that person who was asking that question, yes, your husband's gloom could be normal, or it could be SAD, or seasonal affective disorder, or it could be clinical depression. Again, the key to telling it apart is looking at the pattern, severity, number of symptoms, and functional impact. We said we need at least 5 of a lot of those things. We need functional impairment, and severity enough to impair function. Those are the things we look that helps us tease out one versus the other.
Yeah, and also just that you don't have to wait until it gets the worst that it could possibly get. I mean, it's preventative, mental health, physical health, your health, it's preventative. So use the tools and resources, and you don't have to wait until it's so bad. You can get ahead of it, especially with this predictable pattern,
That's right. That's correct.
Yeah.
So thank you for sending us such a thoughtful question and something to look at and to, talk about again. I know that if you're thinking about it, someone else is too. So thank you for sharing that with us.
Yes. And keep sending us your questions. We're here pretty much every Monday to answer the questions as they come along. And this is great for us to have this and to build our community. And stay warm, stay well, active, get sleep, and we'll see you next time.
All right. Thank you very much.